In today's society, one of the greatest challenges faced by persons with Down syndrome is the lack of awareness, lack of clarity about what is Down syndrome, what are some of the challenges they face, what are some of the medical conditions that they face, what can be done about it. This kind of information, once is disseminated to the people, especially parents, caregivers, teachers, and everybody else who interacts with a person with Down syndrome, their life will change for the better. This video is produced by the Hope Qatar Center for Children with Special Needs during the Down Syndrome Awareness Month to help dispel some of these myths. So what is Down syndrome? Down syndrome is a genetic condition. It is a condition in which the 21st pair of chromosomes has 3 chromosomes rather than 2. So it means they have a total of 47 chromosomes instead of the traditional 46 chromosomes. And this is known as trisomy 21. And this presence of an extra chromosome leads to a lot of challenges. Statistics says that today 1 in every 700 babies are born with Down syndrome. The presence of this extra chromosome leads to certain developmental challenges, both physically as well as intellectually, and that is what we need to take care of. In the year 1866, a British doctor by the name of John Langdon Downes was the first person to list down all the characteristics of an individual with Down syndrome and publish the paper, and therefore since then this condition and persons with this condition are known as those with Down syndrome. We must realize that Down syndrome is not a disease, it's an accident of nature.
Normally, Down syndrome is identified by pediatricians soon after the childbirth. So it will be just an assumption, like focusing on the physical features, low muscle tone, or even consumption in milk. So it can be confirmed only after the genetic test, where we can see the extra 21st chromosome. So we can even identify Down syndrome during the pregnancy time when the child is in mother's womb. So there are few tests like screening tests, diagnostic tests that will be able to provide if the child have Down syndrome or not. For example, ultrasound scannings or amniocentesis, where amniotic fluid from the mother's womb is taken out and tested. These will give an idea if the child has Down syndrome or not.
Seminar crease in the palm of hands, flatter bridge of nose, short waved neck, small ears, smaller hands and feet, tongue thrust, moderately lower IQ levels, and they also have generally short than others their age.
No scientific evidence of any reason why a child was born as a Down syndrome. Some trends says that older parents or those who are at the age of 35 is having more risk of having a Down syndrome child. And also, interfamily marriages could lead to children with special needs, including the Down syndrome.
Some of the health-related issues that Down syndrome adults are facing are congenital heart disease, a hole in the heart which can be repaired early if it is detected early.
They are more prone to having ear infection, then they also has a lot of upper respiratory tract infections. They are prone to having tonsillitis, adenoids, which can be cured with a surgery.
And eyesight issues and eye infections. They do get eyesight issues because most of them do have specs and spectacles because they do have eyesight issues and also eye infections.
They are also prone to having skin allergies and also skin conditions. Also, they have obstructive sleep apnea, which causes obstruction in the breathing during sleep.
Down syndrome is a condition, not a disease, so there is no treatment. Many parents go through alternative treatments and cures, but it is not supported by any research. Intervention focuses on special education, mainstream, occupational therapy, speech therapy, behavior therapy, and physiotherapy. Any treatment addresses the health issues, not the condition of Down syndrome.
So some may grow old, some get married, but they will have a risk of having children with Down syndrome. Most of the children, they go to mainstream schools, some go on for vocations, and there are like many extremely talented musicians, artists, models, actors and sportsmen with Down syndrome.
Something I have learned from people with the Down syndrome is smile always in spite of any challenges. And moreover, stick to values and discipline in life and sometimes be stubborn about it. Give it your best shot even if you know you have weakness. Don't take anything too seriously because nothing is permanent in this world.